As everyone knows, we are going through the fourth industrial revolution, in which the use of the new technologies no longer plays a supporting role and gains more prominence in operations. The concept is directly related to digital transformation that many companies in the most varied fields of activity experience, including health. This movement is primarily responsible for making organizations not only invest in more traditional technologies, but also invest in innovative solutions. This revolution comes at a time when the health systems around the world face the intense pressure caused by growing demand for care, generated by a population that lives longer without necessarily being healthier. It has never been more necessary to rethink care practices that value care outside the hospital, using technology as means normal of purposing delivery value. Therefore, it's necessary to see health as an investment in medium and long-term perspective, developing a model that supports this transformation. According to the World Health Organization, spending in this sector already represents 10% of the world's gross domestic product. The sector's private technological solutions, known as health techs, have been developing every year, raising the technology level of the sector. There are more than 42 unicorn health techs in the world that together have a market value of more than $100 million. Currently, corporations and venture capital companies have their market value assessed by ESG, as companies increasingly need to show that they are sustainable ecologically, socially, and economically. The ESG was created as a metric to assess the performance of company in this new environment. We see young people today in three dimensions: consumer, investor, and part of the job market. Therefore, when we talk about innovative health solutions, we need to create how they are connected with the UN 2030 agenda. This agenda is a global action plan that brings 70 sustainable development goals created to eradicate poverty and promote the dignified life for all, within the conditions that our planet offers and without compromising the quality of life in the next generations. The survival of healthcare companies is critical to delivering innovation to patients, and from the regulatory perspective, it's important to realize that patients' access to new technologies is not affected by approvals for competent authorities, but also by the potential of companies in invest and establish a quality management process based in risk management for design to manufacture and usability. The great enthusiasm generated by advances in artificial intelligence applied to the medical field will only materialize in Brazil if patient data are digitized and made available and in organization comparable way. Only in this way will algorithms be able to contribute to improvement and diagnostic imaging, to discover new drugs, the prioritization of patients in hospitals, among other uses. One of the response of the investments made in public universities is to use the intellectual and the research potential of the FMUs, health teams, and USP professors in their most diverse areas of activity. As determined by innovation law, scientific and technological institutions must have their own technological innovation center, and only 14 means in our ordinance has a technological innovation center formally created in health institutes. Assuming that is the relationship as several facets, they seek to facilitate interaction between research and health managers for the creation of a thematic agenda for the incorporation and innovative process in care practices in healthcare management. The biggest challenge is not to innovate, but to overcome bureaucracy. Establishing international institutions such MIT in United States face similar problems in attempt to bring academia closer to companies. In Brazil, inequality is the main obstacle to doing a good science. One of the great dilemmas faced by academia and companies is the therefore, it's not sustainable for companies or universities pursuing research and innovators independently due to the scarcity of top talents, cost of high-end research, and access to the data. Academia should work with partner companies to create an ecosystem that enables sharing top talents experts in their results. It's also important to build more capacities, both in academia and companies, with invention and innovation capabilities. The time has to understand that the problem belongs to everyone. Is there an answer? The president of FINEP informs that Brazil has about 35% of researchers in the industrial area, that most of them, almost 57%, still work at university. In the United States, for example, the proportion is quite different. Almost 8% of scientists are in companies, while about 15% work in universities. Innovation has been conceived in Brazil as a byproduct growth and not as a prerequisite for development. This is the bottom line in me. We need mindset shift. We act facilitators connecting to loose ends of these complex systems. In our hospital is the largest healthcare complex in Latin America, more 20,000 employees, 66 research laboratories, 1.5 outpatient consults per year, over 100 million images of patients saved. And the most diverse categories of the health innovation ecosystem. We encourage the entrepreneurship in undergraduate students. We are disciplines dedicated to entrepreneurship and innovation within the scope of USP. We use the concept of design thinking to propose a change of mental models in which the change implies less giving answers and more knowing how to ask questions that allow an approach and a new look to the problem to be addressed. Listening to community and understanding this reality makes the development innovation efficient and really impacts people. And the last year, 3 professors of these disciplines were chosen by students as the 10 best university professors of the year. 2 years ago, in the School of Medicine, Enactus team was created. Enactus is the world's largest experimental learning platform dedicated to create a better world while developing the next generation of entrepreneurial leaders and social innovators. The idea of the logo is to represent a bow and arrow, which together we can perform an action, but when separate, none of them is useful. It was inspired by the phrase, an idea without action is like a bow without arrow, said by Martin Luther King Jr. The logo is a origami, a secular Japanese art of paper folding. Initially, it is immensely complicated, but we needed it to be willing to put in the necessary effort and patiently persevere until it's ready. Some projects, this group will be held in the garden of FNUSP as a no pharmacological treatment strategies, dietary change as attuned in long COVID rehabilitation. Another project about the territory of social impact of the actions is the São Remo community, located next to the University City, USP main campus, and which has 90,000 inhabitants. The project aims to encourage co-creation between USP students involved in social entrepreneurship initiatives and youth students from the São Remo community. In this way, the ties between the university and community are strengthened. Focus of the searching for solution to their main problems, starting with the development of educational initiatives which can be expanded after the project is concluded, considering its sustainability. Another thing is guidance students, the professional master degree in a postgraduate course in technological innovation at FMUSP. The aim is to transform the faculty from a supplier for excellent students to a role model innovation, driving helping corporations to transform while giving birth to the new innovative companies. In the discipline of the postgraduate course in technological innovation at FMUSP, usability and human factors related to the interaction with equipment and materials used in the care of surgical patients, which aims to study the concept of products related to the usability of equipment, materials, and medicine related to the healthcare during the preoperative period, considering the various agents involved in the human's focus. In the research group at CNPq and Design Innovation in Health, the group's action is intended to benefit the public health system, and it provides integrating new projects into the lines of care, facilitating communication with the population and promoting autonomy and quality of life through scalable, cost-effective strategies. The group brings together a multidisciplinary team with the participation of research from different areas, design, architecture, engineer, medicine, working in co-creation of projects and in the conduct of investigations that focus both on their specific areas of interest and those interspersed with knowledge complementary. In company through the usability center, as the growing need to ensure the safety of patients and healthcare professionals, as well effective and efficient use of all devices, lead to an introduction to human factors engineer principles and methods in process of design and development in medical devices. The current trend is a large number of devices to operate currently, intercommunicate with each other, incorporate concepts such as Internet of Things, Big Data Analytics, and other technologies. Intellectual property must be protected, taking into account current regulations. Funding for innovative process can come from the government entities or private sector, and the search for funds is frequent need for entrepreneurs. Dissemination of the success stories and examples of academia business collaboration outcomes in the best way to motivate others, and also about improving the environment, explaining rules, and communicate your values. You need to target multiple stakeholders. The aim of the transformation is to increase the volume and quality of research collaboration with industrial partners, along with ability to produce scalable research outcomes available for licensing and spinning of these outcomes into startups. It's always good to actively seek of companies and would benefit from your expert knowledge and technologies for licensing. It's better to collaborate with companies that are willing to support and apply research in publication potential. To strengthen partnerships, you need to organize regular benchmarking events for the local companies seeking talents and the possibility in need some your expertise or technology. The creation process in health must be considered that innovation can bring much more than technological benefits. The innovation process related to a new medical equipment can increase the promotion of the research, train human research, increase the local industry, and contribute to the development and health economic industrial complex. In summary, all actors in the innovation chain, academia, government, the produce sector, and civil society as a whole, need to eliminate the deadly bottlenecks and bureaucracy, unnecessary competitiveness, waste, and rework. In the development process, mixed teams with professionals from different areas working together on a given project can deliver better results. In this context, team leadership and proper use of project management techniques contribute to the better results. The interface between people or teams from companies and universities to work together is an important alternative for increasing innovation. Thank you very much.